Action.
All right, so Dr. Eiseman with anesthesia. I'm here to demonstrate our new airway equipment for anesthesiologists, intensive care, and the emergency department. We now have the Storz CMAC system, which we'll have for all departments at both Columbia St. Mary's, Milwaukee, and Ozaki. And again, the purpose of the video is just to show everybody how these are going to be set up, because the idea is to standardize them in all clinical settings so that it's the exact same setup no matter where you go in the hospital. So the Storz CMAC system will essentially replace the GlideScope system, and it works the same way. It's just a little bit more of a comprehensive airway management system. So you have your screen at the top, which does allow positioning over a patient, which is kind of nice. In the back, there are places to hang flexible bronchoscopes. This is the 5.5 millimeter scope, the larger scope, which will be in all departments. And for the anesthesia department, we'll also have a smaller 4 millimeter scope for a double lumen tube that can hang right here. The scopes will normally be stored in a sterilization compartment that'll sit on the top of the cart, so that they can sit here indefinitely after sterilization. If they hang, Joint Commission requires that they be reprocessed every 7 days, which is not very practical. So the scopes will sit here, and you'll just open these compartments, be able to take your scope out. This is the smaller scope, and then have it hang here and be able to use it for your procedure. I'm going to take this away. I just want to show everybody how we're setting up each of these compartments, because this entire tower is going to replace the difficult airway cart. It's much more elegant, simpler, and has everything that you need to manage a difficult airway. So first of all, it's color coded, so you can see 4 drawers, green, yellow, red, and black. Green being sort of the most commonly used devices, and for the first step of a difficult airway, yellow would be kind of second step, red, and black being, all hands on deck. So in the red compartment, what we have here are all of the actual video laryngoscope blades. So every department will have a Macintosh 3 blade, a Macintosh 4 blade, a Miller 2 blade, and what's called the D blade, which is the hyper curved blade that's most similar to the GlideScope that everybody's familiar with. You can see it says D blade right here. But if you just want a regular Mac blade or Miller blade, those will be there too. There'll also be smaller Miller and Mac blades for the emergency room for the pediatric population. And there'll be a second cable, which we'll demonstrate in a few minutes. Here's the primary cable. There's also some anti-fog solution. I'm going to leave this one out to demonstrate. And this is a stiff endotracheal stylet, similar to the GlideScope stylet that has that hypercurvature. So this is intended to work with the D blade. That'll also be used. The second drawer is the yellow compartment. And this has all of the intubating LMAs. So right now we're using AirQ. In the future we may use LMA Evo, but these are LMAs that have the capability of intubating through them, size 2.5, 3.5, and 4.5. Again, for the emergency room, these also come in size 1.5 and 1, and those will be stored in here as well. And this is the pusher device, so that after you have put in an LMA and then intubate through the LMA, you can then push the endotracheal tube, take the LMA out over it, and you now have an intubated patient. The next drawer is for nasal airways, particularly if you're doing a nasal intubation and you need to serially dilate the nose, and an ovasapien airway, so that if you're doing an oral flexible bronchoscopic intubation, and a jet ventilator, so that if you, for instance, do a needle cricothyroidotomy, you can attach a jet ventilator and be able to jet ventilate patient in a true emergency. We'll also have 14 gauge angiocatheters for that purpose as well. And lastly, the bottom drawer will contain, this is the black drawer, this will contain a needle cricothyroidotomy set. This one has the wire. We're also obtaining sets that are just the knife, bougie, and tube setup. But we'll probably use the Cook Medical. And finally, there are medications in here that can be used for awake fiber optic intubation. So there's an amortizer, topical lidocaine gel for nasal intubations, and viscous lidocaine. And we're working out something with pharmacy to keep track of these meds and to make sure that they're always not expired. So very, very elegant and simple. You will notice that some of the more basic supplies, like basic size endotracheal tubes, basic laryngoscopes, are not in here. Those are in your regular intubation sets and your regular burrito style intubation setups. And so this is really just for the difficult airway to keep everything nice and simple, no duplication. Finally, on the side, there are additional supplies. So we have an exchange catheter. These will come in two sizes, 11 and 14 French exchange catheter. This is a bougie or Eiseman introducer, which can also, obviously be used for difficult intubations. And a new piece of equipment that many people will not be familiar with. This is called an optical stylet. So it's basically a stiff stylet that allows some flexing at the end and can be used to intubate a patient. I'm going to demonstrate the use of this because I think most people are not familiar with this device. So that's the whole setup. So I think everybody knows how to use everything. But what I'm going to show now is using the device, and then I'm going to show you in particular how we can intubate using the optical stylet. So the way that the system works is this is the power button here. So you push the power on, and we're going to hold this in front of the patient like so. This is the main cable which plugs into the side. In this case, because we're going to be using two devices, we're going to use a secondary cable. This is really only needed if you use two devices such as the laryngoscope and a bronchoscope, or the optical stylet at the same time. So most of the time you don't need this. But in this case, I'm going to demonstrate how that works. So there's a, are you still recording? Yes. Yeah. So there's a plug in the back where you plug the second cable into, like so. Okay, and now the way that you plug the scopes in, did I pick the right one? No, it's a match cord. This one's already open. Now that's a blade. We'll take the Mac 3. And I'll open this stylet. So just like a conventional glide scope intubation, we preload the endotracheal tube with the glide scope style stylet, or the curved stylet. In this case, I'm just using a Macintosh blade, but if I was doing, say, an anterior airway, I would usually choose the D blade. The cable plugs in like so. Since this is an interchangeable system, you have to plug the cable into whatever device you're using, whether it's one of the Mac blades, the D blade, the bronchoscope, the optical stylet. So this little knob at the top lines up with the knob on the scope, like so. And you can see that it lights up now, and that's how you know it's active. And you can see on the screen that we have an image. You see a little bit of the blade at the top, so that helps direct where you are. And you are able to take pictures using the button as well, or pressing on the device. So now using our mannequin, we're going to insert the blade And there's our cords right there. And then, again, similar to a glide scope intubation, we watch the tube go in, we back out the stylet, and we've intubated the patient. Okay, but what I want to demonstrate now is the use of the optical stylet, because that's the piece of equipment that most people may not be familiar with. And so let me show you how that works. So here's the optical stylet. And the most useful time you might want to use this is if you're doing an intubation like a glide scope style intubation and the airway is fairly anterior, you can see it maybe at the top of the screen, but you just can't reach it even with that hyper curved stylet. Or if you take a regular stylet and you bend it, 90 to 180 degrees and you still just can't quite get up there. I'm sure each of you has experienced this at some time. This is a device that may help you to reach the cord. So you basically just preload the stylet just like any other stylet, and it kind of pops into place. And now this is where we'll use the secondary cord. We'll plug that in, again, knob to knob, like so. And now once you plug the secondary cord in, you can see this little sort of flip icon. And so we're starting off with, this is the active device. And so we use this device, we find the cords. Now I come in, the tip is, probably about 1.5 inches advanced beyond the endotracheal tube. So we come in like so, and there we can see our device. And now I ask my assistant to switch. And now we're looking through that optical stylet, and there are the cords right there. And I can even use the little flex tip on that device to kind of drive myself right into the cords. And then I ask the assistant to advance the endotracheal tube over the stylet. And that's what they're doing. And there it is. And now I'm pulling the device out, and we can see that the tube is going right through the cords. And there we go. So that's the use of the optical stylet. And you can see that it has this little flexion lever, and that causes about 110, 120 degrees of flexion on the scope. So that's a nice addition. If you're trying to get in there and you're just up a little bit, you can kind of flex the tip just to get into the cords, then straighten it out and pass the tube. So that's the use of the optical stylet. And that's the CMAC device in a nutshell. So we're glad to have gotten this for everybody to use, and we'd like it to be set up the same way in every environment, emergency room, ICU, and OR, and women's hospital, so that wherever you go for a difficult airway, you're going to know what to expect. Thank you.